So I'm going to show you how to set up a sterile table for suturing. Let's say there's a sterile drape. If we have that available to us, it would be in a peel open package like the gloves. So the midwife would peel open the package, pull out the sterile drape, and handling it only by the edges and not touching the white side of the drape, would put it under the birthing parent's bottom and not touch the middle where the sterile field is. So the next thing would be to open the instruments for suturing, only handling the outside edges. And this is clean so far. The inside of it is sterile. There are instruments for a needle driver, and there's a pair of scissors. All of this is sterile, and the 4x4s are sterile as well. So the next thing that the midwife would do is to open her suture and put that on the sterile field. So we're peeling it open and not touching the inside package and just dropping it onto the sterile field. The next thing that you could do, I don't want to drop that yet. Okay, so the next thing that you might do is open the needle and syringe for the lidocaine and drop that onto the sterile field. And then open the package of gloves. And she can put this onto the sterile field as well. And then sometimes a midwife might want some gel. I like to have gel to run the suture through so that it slides through the tissue easier. So I put that on the edge of my sterile field, not touching the sterile field with the package. And the next thing I'm going to do is take these sterile gloves and put them on. So I didn't necessarily have to put them on the sterile field. I could have put them over here because they're still wrapped in the sterile package. Once again, lift the glove up, hold on to the cuff, put on on your dominant hand first. Put your fingers under the cuff, sterile to sterile. Only touch the inside of the glove and work it onto your non-dominant hand. And now your hands are sterile. So you can touch anything in here. The midwife might take this sterile field and move it closer to where she'll be suturing, but ideally this table will be set up at the same level of where you're sitting on the bed to be able to do suturing. So we have 4x4s, we have suturing instruments, we have lidocaine. In order to draw up the lidocaine, the assistant needs to help with that. This is sterile. The lidocaine bottle is not. So the assistant would clean the top. You can't sit on my sterile field. Okay. Sorry. We're trying to keep it very realistic for you. So the assistant will hold the needle. This is where trust comes in. And then you draw back. So I'm not touching anything unsterile. You would put air into it before you draw it out, or you're going to collapse your bottle eventually. So we're going to just stop at 2 milliliters. And then the lid is here, so if you are going to recap, scoop it with the lid on and then snap it down. Okay, sutures can come out, peel them out, and it attaches to the needle holder. It attaches to the base of the needle. Click it down and you're ready to go. I don't want to open these. Okay. Yeah, okay, sure, I'll open them. Never mind, opening the package. So this is the package that was dropped out of the external package. And double wrapping is, for everything sterile, double wrapping is what's advised. I'm going to use my needle holders to get this out because I don't like playing that close to a needle. And then you can see the needle and the suture. It's a really long one, but I'm going to secure my needle a little better. And you will get lots and lots of information on how to do this once you get into your suturing class. But this is still my sterile field, so my things are going to go right here until I'm ready to start suturing. And the first thing I would do is give lidocaine and wait at least a minute for it to take effect before beginning suturing. And that is setting up a sterile table.